So, like a lot of you, I've definitely seen the photos and heard the buzz around President Trump's health recently, specifically the leg swelling and, that bruising on his hand. Mm-hmm. It's kind of amazing how fast that stuff takes off, right? Anyway, today we want to cut through all that noise and really look at the official medical announcement, get straight to the facts.
Exactly. And for this deep dive, we're drawing directly from reports that just came out yesterday, July 17th. We're talking CNN, Politico, ABC News, Fox News.
Okay.
So our goal here is pretty straightforward. Unpack what the White House medical team actually found and reported. Give you a clear, factual picture of what these conditions really mean.
Right. So let's start with the leg swelling. That seemed to kick things off. We know the president, he's 79, noticed some mild swelling in his lower legs. That led to a full checkup by the White House medical unit. What did they actually find?
Yeah, the diagnosis they landed on is chronic venous insufficiency, CVI for short.
Okay, CVI. What does that mean in plain English?
Basically, think about the veins in your legs. They have these little one-way valves, right? Mm-hmm. They help push blood back up towards the heart against gravity. Uh-huh. With CVI, those valves, they're just not working perfectly. They're a bit leaky, you could say. So blood doesn't flow back up as efficiently, and it can kind of pool down in the lower legs, causing that swelling.
Okay. Is that common?
It's actually pretty common, yeah, especially if people get older. The sources we looked at say it affects maybe 1 in 20 adults and something like 150,000 new cases diagnosed each year, particularly, in folks over 70.
Got it. So common, especially for his age group. But I imagine when you see swelling, your mind jumps to, more serious possibilities, heart issues, kidney problems. How did they rule that stuff out?
That's a really important point. They were very thorough. The reports mentioned bilateral lower extremity venous Doppler ultrasounds.
Okay, that sounds technical.
It does, but it's essentially using sound waves, kind of like radar, to get a visual on the blood flow in his leg veins. See if there are blockages or where it might be pooling. And the key finding: no evidence of deep vein thrombosis DVT, those dangerous clots, and no arterial disease either. That's crucial.
Definitely.
Plus, all the lab work came back, quote, within normal limits. They did an echocardiogram too, checked the heart structure and function, also normal. So they specifically ruled out heart failure, kidney impairment, or any other systemic illness causing the swelling.
So a really comprehensive workup then.
Absolutely. It allowed them to pinpoint the CVI as the cause, describe it as relatively minor, and importantly note, the president is experiencing, quote, no discomfort. They call the condition benign. Benign,
okay. That really frames it differently than just, seeing a photo and speculating.
Precisely. It moves from speculation to documented medical assessment.
Okay, let's pivot then. The other thing people noticed was the bruising on the back of his hand. Saw those pictures myself. What's the official word on that?
Right. So the explanation given for the hand bruising comes down to two things, basically. First, minor soft tissue irritation from lots of handshaking. And second, the fact that he takes aspirin.
Handshaking and aspirin, how do those connect?
Well, think about shaking, potentially hundreds of hands, some quite firmly. Over time, that can cause tiny little stresses, maybe even tiny ruptured blood vessels just under the skin. It's delicate tissue there. Mm-hmm. Then you add in daily aspirin. It's often taken as part of a, quote, standard cardiovascular prevention regimen, basically, routine heart care. Aspirin thins the blood a little.
Right, makes you bruise more easily.
Exactly. So those tiny stresses from handshaking, which might normally be invisible, are much more likely to show up as a visible bruise when someone's taking aspirin. It's described as a, quote, well-known and benign side effect of aspirin therapy. Not really an injury, more just a side effect.
Interesting. Something so routine like shaking hands combined with a common medication leading to something so visible and talked about.
Yeah, it's a confluence of factors.
So, bringing it all together then, the CVI in the legs, the bruising on the hand, what's the big picture message from the White House announcement based on these reports?
I think the main takeaway is one of transparency and thoroughness in the evaluation. They've addressed these specific observations head on.
Right.
They detailed a pretty common age-related condition, the CVI, and a well-understood benign side effect of a standard medication. And the really extensive testing confirmed his overall health remains, quote, excellent, despite these minor visible things.
It really does give you a different perspective, doesn't it? Seeing the detailed medical explanation, it makes you think about how these common health things, especially as we age, suddenly become major public topics.
Absolutely. And it highlights the importance of sticking to the actual medical facts rather than getting swept up in speculation.
Definitely food for thought there. How we process information about public figures' health and maybe the need for clear communication versus jumping to conclusions, something to mull over.